Now let's turn to the third major redesign topic, healthcare. Healthcare is second only to education in expenditure of dollars in the state general fund. It's a large and growing component of cost for employers, and like education, the system is ripe for redesign. And like education, enormous progress has been made this past year. To give you a report, we've invited three prominent leaders to join us this morning. Bill Thorndike, president of Medford Fabrication, highly valued Pacific Power customer out of Medford. He serves as the chair of the Health Leadership Roundtable, a forum for business, healthcare, and public leaders to discuss policy and progress in meeting our healthcare goals. Bill, welcome. Bill served also as the chair of the Health Fund Board from 2007 to 2009. My friend Mark Ganz, president and CEO of Regents Blue Cross. He's been active with the Oregon Business Plan for several years as co-chair of the team that's developed and championed the business plan healthcare recommendation. And also Joe Robertson, president of the Oregon Health and Science University. He's the vice chair of the Oregon Health Policy Board. So starting with Bill, let's hear a report on how we're addressing our goals to improve affordability, quality, and access to health care. I'll get out of the way and let each of them follow one another. Thank you all.
Thanks, Pat. Thank you. 77 years ago, in the depths of the Great Depression, my grandfather, a banker in Medford, helped the ladies who ran the Medford Community Hospital with a loan to buy a farm to raise the in-kind payments of farmers to provide good health and healthy food to their patients. Just as today, we are concerned about our healthcare delivery system, the economics of healthcare, and the role of health in the success of business, communities, and the very health of the state of Oregon. It is timely, given the tremendous changes we are living with, to recognize the accomplishments of our legislators, the state, the healthcare industry, and many others, including many of you who are involved in your own local hospitals, clinics, or health-related foundations, with the progress we are making and the need to continue the work in the future. As a Southern Oregon manufacturer, I know only too well the charges that run through our P&L for health and workers' compensation insurance, costs coming in right after labor and direct materials. Electricity is down a little bit. I guess you can say that my service on the boards of insurance companies, state commissions, business association task force, and my community hospital system are driven not only by self-interest, but by how critical paying attention to these costs are to my business, our employees, and community. As the chair of the Oregon Business Healthcare Roundtable, I hope you will seek ways to be active participants and supporters of the reforms we will be bringing you up to date on in this presentation. This past year has been particularly exciting as the legislature passed two major bills that supported the overall strategy first identified in the Oregon Health Plan Board blueprint and in the Oregon Business Plan, and then pushed forward by the new Oregon Health Policy Board and the Oregon Health Authority. First, the passage of the exchange bill and the Medicaid transformation bills are critical elements of moving to a reformed and more sustainable health care system. The exchange provides more options to small employers and to individuals to get insurance. When successful, transforming the delivery system for Medicaid patients will lead to better health outcomes, higher patient satisfaction, and lower costs for that population and more predictable costs for the state. As for those buying insurance, private insurance, employers and individuals, this will minimize the cost shift. The business community supported both of these bills, and the willingness and the leadership of the legislature and the governor enabled these to become law. Again, across the country, we are leading the way in healthcare reform. However, this is just the beginning. We have a lot of work to do to make them fully operational, and it will require work in new ways. We hear about clear outcomes and innovation as being critical to this task. And we support the leadership from the business community and the legislature and governor as we get there. Of particular interest, I would like to recognize the work of the Oregon Health Leadership Council. This is a unique, i.e. not done anywhere else, way of bringing together statewide leaders around healthcare issues at the request of the business community to collectively implement solutions to slow down the rate of increase in the health costs and in premiums for insurance. Each quarter, the co-chairs discuss their progress with the Business Healthcare Roundtable that I have the privilege to chair, and we learn how we can be partners in helping to support their work. Their work has been impressive, and I would encourage you to find out more or to get involved with the Roundtable through your business associations. We have made incredible progress on healthcare agenda, and I know that we'll keep moving forward. Now I'd like to turn it over to Mark Ganz, CEO, I understand, of Cambia, formerly known as Regents, who will talk more about the challenge at hand and the steps the Oregon Business Plan outlined to address the healthcare dilemma. Mark?
Thank you, Bill. I agree that we are making very good progress, and it's largely due to your leadership and so many people that have come together from the broader business community to realize that we all have a dog in this fight in terms of creating a more sustainable healthcare system that is more responsive to individuals. My job today is to give you a quick historical setting of why the Oregon Business Plan decided to take on healthcare and what we started in 2007. And then Joe will talk about progress specifically being made today going forward. Certainly, it's important as we move towards solutions to understand the historical context and the root causes of the healthcare cost increases that we are all facing. And I would turn your attention to the slide that's up on the screens. And the way that I think about it, it's very personal for me because my mother passed away 2 years ago from after a long battle with congestive heart failure. And we experienced as a family almost every one of these drivers. Certainly, she was aging. She had a chronic condition that was primarily the result of genetics in the family. And because she was able to live longer because of technology, what probably did kill her mother at a much earlier age became a chronic condition for my mother, and she lived a lot longer with it. That was because of the institution of technology that exists today that's very expensive, that didn't exist when my grandmother was facing the same ordeal. Hopefully I'll live longer than my mother. I'm sure I have those wonderful genes as well. And then lifestyles. My mother was a smoker for most of her life, which very much increased her risks, and I'm almost certainly led to the earlier onset of her condition. Then when she was actually in the care system, we noted as a family the surprisingly dearth of consumer choice, of any considerations by providers about the price of what they were, of the interventions that they were bringing forward. And when we as a family would ask about cost, ask about what their price was, we couldn't get the information because the answer was, well, it depends. It depends on what Medicare is paying this year or what kind of supplemental coverage she had. And there was a complete dearth of decision support tools, although I'm proud to say that because she was a customer of Regents, we have been one of the leaders in decision support tools for patients, and so as during the latter part of her disease, we had more and more decision support tools that she was able to have, but still not nearly enough. And certainly we ran into consistently a lack of accountability on the part of providers because they did not have incentives around driving value and making sure that she was getting the right treatment. Instead, we often had a situation where she would go to the hospital for something small, and we as a family would refer to it as she would get on the roller coaster and be taken for a ride that was not necessarily always related to her disease and condition. All of this creates and has been causing the increase in costs, and employers are paying the bill. The next slide talks about the other aspect that drives costs, which is the vicious cycle, and I'll start you at the upper left-hand corner, where you have healthcare cost increases for what I just described in the first slide. And then what happens is state or federal government, because they're feeling the pressure of the increased costs, begin to cut back on benefits or cut back on provider payments. So here, as you follow it across the top line, we use Medicaid as an example. The state cuts back on Medicaid eligibility, which drives a greater degree of uninsured and a greater use of emergency rooms, which are probably the most expensive family physician or family or primary care you can get. If the state underpays providers, guess where that cost gets shoved off? It gets moved over to commercial insurers, and that comes right out in the rates that you pay. In a sense, it's a hidden tax. And that cost shift just continues to feed increased costs, which then cause rates to go up. And you could pretty much start anywhere on that slide, and you would see that the cycle begins and it repeats itself. Our goal in the Oregon Business Plan is to defeat this vicious cycle by getting at the root causes that drive costs, by creating a greater degree of accountability using the business principles that we expect from every other economic sector that we deal with as businesses, and to try to derive a greater degree of accountability from all in the system so that it really serves individuals and their families with a more economically sustainable model, simply. So, what did we do? In 2007, this slide depicts the strategic plan, and this is a dated slide purposely. This is what we did in 2007, and it's important because it's something I think you all can be proud of, because many of your colleagues came together long before healthcare reform legislation was in the hopper and said, as a business community, what can we do to drive a more virtuous cycle than what we have? And it really started with, if you look across the top, those are some of the legislative goals that were set and sort of marching through. And then below were things that we felt that employers could and should do. Because, frankly, as employers, we have we're the largest subsidizers of healthcare costs in this country, and we're small communities. And real transformation in this country generally does not happen through large, sweeping national programs. It happens on the ground in smaller communities, and employers often have been the biggest driver of change in terms of healthcare benefits and healthcare transformation in the past, and the idea was to harness that to take it forward. So we started with these elements. Number one, encourage and promote a culture of wellness and personal responsibility for health, and start in the workplace and work out toward employees' families. 2, design benefits to improve health and use of medical services that have demonstrated value and discourage the use of those that don't. And that's not an easy thing to do because every employee, every patient's situation is unique. So trying to have a very consumer-focused way of approaching it, but nonetheless moving in that direction. And finally, changing the expectations and incentives for health plans and the healthcare delivery system, hospitals, physicians, and other healthcare providers by creating financial incentives for delivering value and driving the variation, the incredible variation, even within this city, variation in care quality across the system. The second was to make sure that we create an effective market. The idea is focusing on giving consumers a greater degree of choice through better information and more skin in the game so that they have a more complete relationship with their healthcare providers, and that is grounded in a much higher degree of transparency around cost and quality than exists and is available today. To make sure that benefit plans have appropriate cost sharing both at the time of the choice of health plan, which is what happens in open enrollment in your companies, but also, and maybe even more importantly, at the point that a person is actually obtaining care, so that they can hold their providers to a higher degree of accountability around quality and cost. And 3, making sure that they have that information readily available. Finally, we really focused in 2007 on the notion of an exchange. Again, this was before federal health care reform, the belief that a consumer-based exchange, an Expedia, if you will, for health care, would be a good idea and would create a greater degree of transparency. Let's harness the internet and the way that people interact with it to move things forward. And we're pleased that, in fact, the state of Oregon is in this position, currently a leader in moving in that direction. It must be designed, however, and is something that we're as a business community watching, making sure that it be designed and run like a business, focused on winning consumers as opposed to regulating them there, and making sure that this becomes a very easy way for people to purchase health care in a more transparent fashion. The OPB strategy has several other tactics to addressing healthcare issues, but right now we think the focus is making sure the exchange is properly designed and is an economically sustainable model, and one that is nimble, because believe me, we'll make mistakes. And the idea is to make sure that we can learn from those mistakes, make quick, innovative changes, and move forward and continue on a path that creates a more consumer-focused system, and one that is less taxing to our businesses as the healthcare system is today. A lot of good work has been done, and I'm pleased to now introduce Dr. Joe Robertson, who really needs no introduction. He's doing a phenomenal job of leading one of the most admired organizations in the state, Oregon Health and Science University, an organization that is doing amazing work not just in the metro area where it exists, but throughout the state in supporting so many hospitals in smaller towns so that they can continue in business because they have the support of a fine research and tertiary care center like Oregon Health and Science University. It's a great asset to this state, and Dr. Robertson is a great asset to this state, and I'm pleased to introduce him.
Thank you, Mark. It is really a great honor to be involved in this conversation about healthcare reform. Bill and Mark have just done a great job of giving you a situational analysis and creating the burning platform. And as you know from looking at your program, the detailed answers to healthcare reform are going to be unveiled tomorrow. So my goal, as Duncan has said, is to keep you interested enough that you'll come back. So toward that end, I have only 2 slides, and I'm a very visually oriented person, and all of us have seen lots of figures, but I chose these 2 slides so that maybe you can carry this image with you. And the first slide here shows the increasing burden of health care on the federal government, and it is the primary driver of the future increases in federal spending. And the second shows the situation in the state. In the top line, it was the current projected of increased spending for Medicaid. The bottom line shows what we hope to achieve through transformation. And if you notice, the bottom line does not have a slope that's as great as the top line, and that's what we mean by bending the cost curve, and that is the long-term objective of healthcare reform, that and providing quality care. Now, I think the message should be clear from these 2 slides that healthcare reform is everyone's problem. The economics are overwhelming. Really, there are few questions that remain about healthcare reform. We no longer, I think, are going to debate if it's going to happen. There's little question about when. It has to be now. Really, the only question that remains is how is it going to happen? What's it going to mean? Well, although we don't have the exact answers, there's one axiom to healthcare reform, and that is that healthcare reform must include all populations. And by that, I mean we must also find a solution, and a very viable solution, for the Medicaid and the uninsured. If we do not do that, we will not succeed. And as we all know, not will we only have poor medical outcomes, we'll have social unrest, and we'll have a great financial burden on all the business enterprises represented here today. And if we're going to succeed, the state must set the vision and determine the outcomes. There will be a lot of flexibility at the individual community level, but we must be united in the pursuit of specific outcomes. I said there was one axiom. I think there are three principles, and that is that healthcare reform has to be recognized as a community problem. It requires a community solution, and it mandates a new orientation toward community health. Now, with regard to being a community problem, we've spoken about the economics, but it's also a community problem because each community, each population of patients requires a different solution. And again, that's why anything that we mandate on a state level must have the flexibility to be implemented successfully in the community. When I talk about community solutions, I mean working together in a new way. I was inspired by what we heard earlier this morning about how various entities had come together to work collectively to improve the utilization and the health of our forest lands. I think that's a wonderful analogy for what we have to do in healthcare reform. Parties that haven't worked together need to work together. We need to become more familiar with the art of co-opetition. Yes, we will still compete in the private sector, but for this population, we must come together and partner and share scarce resources in pursuit of a common goal. And finally, I would like to just say a few words about what it means to seek community health. It means that we have to be committed to using evidence-based medicine to achieve the most value for our healthcare dollar. Now, this represents a change in our social contract. It means that the focus will be on meeting community needs rather than individual wants. I am convinced that all of us gathered here today can work together to pursue this common goal, a goal of a sustainable healthcare system. Providers, health systems, insurers, the business community, patients, and government can all be united in this effort. But to succeed, we will need your help. We ask you to stay enjoined, and we hope that you'll return and visit with us again tomorrow. Thank you.